global health crisis, the likes of which the world is witnessing today, creates an opportunity to dive deep into the nature of what connects us all, while at the same time providing us with the collective strength and wisdom to accomplish. In the past, we as a global community have faced and successfully tackled threats to health of our people by a collective sense of purpose, supporting and collaborating with each other. I look forward to similar cooperation and mutually respectful and useful collaborations to deal with the coronavirus disease COVID-19. While some of the countries, particularly Japan, Singapore, South Korea, have fared well, others are still struggling with COVID-19. The scale of impact is unprecedented and therefore calls for cooperation between nations to attain normalcy. Excellencies, India has successfully tackled public health emergencies of international concern and pandemics in the past as well. This time, the hallmark of our approach has been fivefold: maintaining a continuous situation awareness, preemptive and proactive approach, graded response as per continuously evolving scenario, intersectoral coordination at all levels, and lastly, but most importantly, creating a people's movement to combat this disease. Our efforts have been preemptive and proactive. We started surveillance of flights from COVID-affected countries 12 days before we even had the first case in India on the 30th of January 2020. By 22nd of March, with less than 400 cases, we banned all international flights to and from India, and by the 25th of March, implemented a nationwide lockdown. As of today, the 19th of April, we have completed 25 days of lockdown, which will further extend till the 3rd of May. The results of the same were realized when our case doubling rate, which was about 3.4 days on the 17th of March, dropped to 4.4 days by the 25th of March and is currently about 7.4 days. Much before the outbreak was declared a public health emergency of international concern by the World Health Organization, India was much ahead in implementing actions targeting core capacities as mandated under the international health regulations. Our nation has the requisite national core capacities stipulated in the international health regulations to manage public health emergencies. The Integrated Disease Surveillance Program, which is a nationwide surveillance system for epidemic-prone diseases, has been activated towards COVID response and is being further strengthened with substantive digital inputs. India has made the conscious decision to focus on building exclusive infrastructure for management of COVID patients so that there is no intermingling of COVID patients. All the people who are tested positive are treated in one of the three types of dedicated COVID management centers: COVID care centers for mild symptomatic cases, COVID health centers for moderate cases, and COVID hospitals for severe cases. These dedicated COVID facilities are mapped to each other in the design of a referral network architecture for dynamic movement of patients as symptoms evolve so that optimal clinical care can be provided timely, commensurate to symptoms. In the absence of any specific drug or vaccine, India has also relied on various non-pharmacological interventions. Particular focus was on measures like social distancing and risk communication to the masses on simple public health interventions like hand hygiene and respiratory etiquettes. While the traditional ways and means to tackle the disease were being implemented, our scientists and doctors are exploring new and innovative measures to maximize our reach. Cutting-edge technology is being used to not only maintain inventory and patient-level information, direct-to-citizen apps are being used for communicating geospatial risk and best practices to be followed. Excellencies, since the onset of this pandemic, India has taken leadership and assisted neighboring countries in multitude of ways. During medical evacuation undertaken by India from Wuhan, China, as well as from COVID-19 affected Diamond Princess cruise ship, we evacuated foreign nationals from Maldives, Bangladesh, Myanmar, Maldives, South Africa, USA, Madagascar, Sri Lanka, Nepal, South Africa and Peru. India as a global leader in pharmaceuticals has stepped to make sure supplies of drugs like hydroxychloroquine is made available to countries around the world. India is working with global partners to ensure that effective drugs and vaccines can be developed and made available to all of us as soon as possible. Honorable Chair, I would like to reiterate India's support to this global health agenda. India looks forward towards working with G20 member countries to pursue unified efforts towards mitigation of COVID-19.